I wanted to address the TikTok I posted yesterday about my pet peeve working in triage in the ER.
Respectfully, you're close, but I don't think you're quite still getting it. So this creator did a video that was meant to be a joke, and it was not well received, it sounds like, and it's now been taken down. And I think it's worth a conversation about how we behave publicly as the medical community. So people in the medical community deal with really rough stuff. We see terrible, heartbreaking things on a daily basis, and it's extremely difficult to cope with these things. And a very common coping mechanism is dark humor. We see horrible things, and making light of them makes you feel in control of them and maybe like it's not so bad. So this is a very common thing you see with medical professionals. But should it be publicly aired? I would argue no, and I think some of the responses to his video tell you why. People come to us in the hospital in their most vulnerable moments. They don't know what's going on when they show up in ER triage at 2 a.m. They see a blood pressure that is scary to them. It's not scary to you, but it's really scary to them. They're not there to make your life difficult. They're not there to increase wait times. They really don't know, and they're asking for help. And when they see things like this, it makes it feel as though we're not there to help them. And oh, I recognize, in my specialty in particular, I can walk into a room with a trauma patient that lost a limb, a burn patient, and then a few doors down, a tummy tuck patient. And sometimes it's hard when the tummy tuck patient is complaining more than the trauma patients. But you have to understand, people are where they're at, and they only know what they know. They don't know all of what we see. They just know their own reality, and what they're going through can be really scary to them when it's not scary to us. I always want people comfortable coming to me as a physician. I never want them to feel judged. I never want them to avoid seeing me because they're concerned about my reaction. And when we put some of this dark humor out there, you make people think the medical community doesn't care. And that isn't the intention, but that's how it comes off. And it's really disappointing to see so many people defending it in the comments. When you say something publicly like this, you can harm our relationship with the general public. It's not good. It's not okay. We shouldn't be doing it, in my opinion. Save this stuff for internal, for your doctor groups, your paramedic groups, your friend group. This is not something that's meant to be public because we don't want to harm our relationship with people. We want everyone comfortable coming to us because, again, they don't know what a serious concern is. They're not medical professionals. And it might be annoying to you to have a line of people that don't have a real emergency in your mind, but they don't know it's not a real emergency. We're there to help them understand and help them feel better and make sure they're okay. We're not there to scare them away from coming back in the future because it might be something concerning next time. It might be missed because you scared them away.